I'm Michael O'Connell. I'm a licensed clinical social worker here at the Road Home. I've been here since 2020. I'm also an Army veteran. I was with the 10th Mountain Division and deployed to Iraq in 2006, 2007, which was when the surge was happening, for those of you that are old enough to remember. So I've done a range of things here since 2020. So I started doing a lot of intake assessment. I've done some outpatient work. I've worked with our kind of flagship in-person accelerated treatment program. And lately I've been working with our virtual accelerated treatment. I think just working with the military community that I'm a part of is wonderful, and their families. I love that we can treat a wide range of individuals. So not just those who've been in the military, but their family, kids, couple stuff. So I like that. And then I think people just get better, and you can see it, especially in these sort of accelerated treatment programs where it isn't 3, 4, 5, 6 months. In as little as 3 or 4 days here, you can see people kind of with a weight off their shoulder, feeling better and seeing that improvement. And it's just a beautiful thing to see. With PTSD, there's one commonality, which is exposure to a traumatic experience. I think the symptoms can range all over the place. And what might have been a traumatic experience for one military veteran might have been just a Tuesday for another one. So the impact can just vary, and you just never know what might stick with people. And for a lot of folks we work with, many of them unfortunately have been exposed to dozens, even hundreds of traumatic events. And there might be 1, 2, 3, or 4 that really stick with them. And that's kind of what we hone in on here. As far as the symptoms, they vary a lot too. I think, in the movies, what we see are sort of more dramatic sort of flashbacks or really reliving the experience or going back to that place. And that certainly occurs, and people do have that, but that's a symptom that not everyone has. It's usually a lot more subtle. And typically the family members and like loved ones and friends can kind of see it first, because it can just be part of our life, right? So we might be a little more on edge, hypervigilance, irritable, angry, trouble sleeping. And I think other people can kind of notice that first. Internally, emotionally, right, there can be sort of guilt, shame, fear, anger. All those feelings can come up. It can change kind of how we think about things, of like what's safe, what's not, who do we trust, who don't we trust. All that can be affected, and sometimes it can be a very subtle thing. And then oftentimes just thinking about an event, right? So the traumatic experience, it might just come up as you're sitting there. There could be reminders. And a big piece of this is we don't like to think about it, right? Because it might be one of the worst days of our life or worst weeks. So we want to avoid those experiences, right? So avoiding thinking about it, avoiding situations. And then the issue with all of this is it can lead to its own problems, right? So if we're working really hard to distract ourselves, we're overworking, we might use alcohol or substances to distract ourselves, risky behavior, that can then kind of take on problems of its own. And again, none of that is directly PTSD related, but they're often go together. And I think family and friends can kind of see that, and we can kind of notice it about ourselves. So someone might have 2 or 3 of those symptoms I listed. There could be many other ones, or we could have all of them, right? So, and I think it's tough, especially if you've lived with it. For many folks, this has been going on for 10, 15, 20 years. When we get people who come in for accelerated treatment and the event that bothers them happened a year or 2 ago, we're excited because you can get ahead of it. And we work with Vietnam veterans. I've worked with individuals who are in their late 70s, and they're happy they did this work. I don't think it's ever too late to get some relief, and treatment works. We have a variety of approaches. I think there's a few what they call gold standard treatments that have been around for decades, and we know they work. They're heavily researched. The vast majority of people are going to be feeling better. And typically there's a cognitive approach. So we use cognitive processing therapy for PTSD, CPT. We do it, the VA does it, many other places do it because it works. And that kind of approaches how we're thinking about what happened. So a little bit less about the event and all the details, but how are we looking at it now? Like, if we're judging ourselves, I should have done this, if this had done this, if this commander had done that, and we kind of get stuck in that traumatic experience. So when you come here, you can explore those thoughts in a very supported environment and maybe get some answers, or find out maybe there aren't really good answers to some of those questions, but it can help get us unstuck from that experience. We also do sort of exposure therapies, where if it's an event that was just really upsetting and we just don't like thinking about it or approaching it, we can then approach that in a supported environment So that can be prolonged exposure, written exposure therapies that also work. And they do it a little differently. And I think a piece of that here is coming in, talking to one of our clinicians for an hour or so, getting an assessment done, and then coming up with a plan on like what's going to work best for you. And we do have a lot of options. In addition to all that, we do another treatment called Unified Protocol, which targets anxiety and depression symptoms, which also have a heavy overlap with PTSD, and is a little bit more present focused, but is also effective at treating it. In addition, if people are having sleep issues, trouble sleeping, anger management, communication skills, those are all things that we sort of work on that are adjacent to PTSD, trauma, depression, but just a little bit more specific. And I think a big piece is just coming in, making the call, having the conversation with a professional here who has very likely treated and assessed hundreds of PTSD cases, because that's what we do, and just deciding what's going to work for you. I think the message I would give is, one, it's never too late. I think the time investment, if this has been something that maybe has been bugging you for years, you can do this work in a week or two. And it does get better. Most people are feeling significantly better, and the improvements stay. So we follow up with folks, and we know a year later, if people are feeling better when they leave here, they're very likely going to be feeling better a year from now. So it's treatable. If an incident that is bothering you happened a year ago or 50 years ago, it works for everyone. And I don't know, life can get easier.